Welcome to the MacArthur Foundation's 100&Change Finalist Forum. Please welcome President of the John D. and Catherine T. MacArthur Foundation, John Palfrey.
Hello, I'm John Palfrey, and I'm very happy to welcome all of you to the MacArthur Foundation 100&Change Finalist Forum. We are not in person, but we are together, and I'm deeply grateful to be in community with you and engaged in such important work. 2020 was a year like no other. We know that times of deep uncertainty can become times of transformational growth. We watched as scientists from all over the world banded together to develop a vaccine for a global pandemic in an unprecedented amount of time. And it wasn't only the scientists who were thinking big. We saw one of the largest social justice movements in our nation's history with the Black Lives Matter demonstrations. And every one of us tapped new reserves of resilience every day to keep our families safe and to care for our communities. The cracks in our foundation have been exposed over the past year. Our mounting crises are now laid bare for everyone to see. But in those cracks, there is light. As a society, we can see our shortcomings just as we can see the possibility all around us to think bigger, to do more, to be bolder. Preventing disease, ending homelessness, preserving our oceans, saving lives, and telling our stories, this is work that repairs our bonds and gives us a common sense of purpose. The finalists you are going to hear from today are bringing about the kind of global change that will be felt by millions, not just in the lives saved, but in the lives restored, the health of our planet, and the strength of our democracy. I am so grateful and so excited to be bringing you solutions. Their ideas are as inspiring as they are possible. And I want to thank you for being with us today and joining us along this incredible journey. You are in exceptionally good hands with Cecilia Conrad, who will be hosting our program, and I will see you after the presentations. Thank you again for thinking big with us.
Hello, everyone. I'm Cecilia Conrad. I am extraordinarily grateful to have this role today and to serve as Managing Director of 100&Change throughout the competition. During the spring of this last challenging year, I had a ritual. Every morning, I would read through a few 100&Change grant proposals, and I would feel better. Some called it hope scrolling. I had the great joy of reading 475 ambitious, insightful, and high-impact submissions of problem solvers across the country and around the world. We all get to be a part of making these ideas a reality to help these teams match the scale of the problems that they address. I want to thank everyone who has participated in this process. I want to thank all of you who lift up and amplify this incredible work. If you've connected a project with a new donor, made an additional grant, brought in a finalist to speak at an institution, everything you do adds to the good we are able to put in the world. And this year, we need as much good as we can possibly get. Today, we are going to hear from 3 of our 6 finalists. Each finalist will be introduced by an expert in their field. And after the presentation, I will moderate a brief Q&A. These finalists have been working for months with teams of expert advisors to make their proposals as strong as possible so that they can make a sustained impact on the world. Their projects will change lives, not just the 100 million grant recipient, but every organization and collaboration represented here today. Let's get started. First up is Pristine Seas, a project of National Geographic. Human life on Earth does not exist without our oceans, but climate change and overexploitation have pushed marine life to the brink of extinction. Pristine Seas is working to set up dedicated marine protected areas that not only protect biodiversity and increase our food supply, but also support the fisheries that are important for local fishermen and their livelihoods. I'm pleased today to welcome Rebecca Ng, who leads the marine wildlife work at Vulcan. She will introduce Pristine Seas and their important work. Welcome, Rebecca.
Thank you so much for the introduction, Cecilia. For those who have not yet heard of or partnered with Vulcan and the Paul G. Allen Family Foundation, our philanthropic mission is quite simple: to make and leave the world a better place. Through our investments and developments in technology, data and science, and importantly, through partnerships, we tackle tough challenges that generate impact both globally and locally. One such challenge is the one facing our ocean. As you'll learn from the next finalist, National Geographic's Pristine Seas, our ocean is in crisis. Coral reef bleaching due to warming waters, acidification, the overexploitation of fish and marine resources, species extinctions, habitat destruction, and pollution are all eroding the ability of our ocean to sustain life, produce the air we breathe, sequester carbon, and provide food and economic services for billions of people. And yet, a healthy ocean is critical for a healthy planet. So how can we ensure a thriving ocean? The next finalist shows that there are many different approaches. While their work is focused on establishing well-enforced protected areas in our ocean known as marine protected areas, it also includes other critical components that are necessary for success. Number one, National Geographic's Pristine Seas supports bold and transformative actions. Integrated, holistic programs are needed to support efforts to combat climate change impacts, save endangered species, enhance effectiveness of marine protected areas, and tackle unsustainable fishing. Pristine Seas invests and implements groundbreaking science and seeks to fill critical data gaps. And number two, they build and strengthen partnerships. The challenges we face over our ocean are too big for any one organization to solve alone. There is a tremendous need for continued collaboration and coordination to protect 30% of our ocean by 2030, to prevent an irreversible loss of marine biodiversity and resilience. And number three, they commit resources towards a shared agenda. Pristine Seas proposes specific steps to help achieve our collective goals while engaging with local communities and working with funders and decision makers, scientists, and governments. This decade will determine the fate of our ocean and therefore the fate of our planet. There is no time to waste. Establishing and enforcing marine protected areas are foundational to our ability to safeguard the ocean. Science now shows that they work by allowing space to conserve, restore, and replenish. Finding a program and approach that establishes and enforces marine protected areas and meets the three components I mentioned earlier is no easy feat. But this is what our esteemed partner, National Geographic Pristine Seas, strives to do to ensure that critical portions of our ocean are indeed protected. As you'll hear in the upcoming video, Enrique Sala makes a very compelling case to act now.
The ocean sustains livelihoods for billions around the world, gives us food and half of the oxygen we breathe. It captures carbon from the air and regulates the climate. Without the ocean, human life on Earth would be impossible. But increasing overexploitation and global warming are destroying biodiversity and bringing the ocean to a tipping point beyond which we may never recover. The global catch of wild fish has been declining since 1995, and 90% of the large animals in the ocean are gone. Coral reefs and other marine ecosystems that provide food security and other key benefits for hundreds of millions of people are being destroyed by ocean warming and acidification. Nature cannot keep up with us. Our impacts to the ocean affect all people on Earth, but especially coastal communities, particularly in developing countries, given their high reliance on ocean biodiversity. The loss of biodiversity, together with climate change, is the most urgent global crisis affecting our planet. Our solution is Marine Protected Areas, or MPAs, in which fishing and other damaging activities are banned. MPAs are like national parks in the sea and provide an essential part of the solution for three of the major problems affecting humanity. First, the biodiversity crisis. The abundance of fish increases on average six-fold inside MPAs, and barren underwater seascapes are restored into thriving, diverse ecosystems. Second, food security for a growing population. Larger animals in MPAs produce many more babies, which together with the spillover of adult fish help to replenish nearby areas and improve the livelihoods of local fishermen. More fish also attract tourists, who help create jobs and bring in significant economic benefits to these local communities. And third, climate change. Our new research shows that protecting the right places could prevent CO2 emissions at a scale similar to that of aviation and shipping. That would help mitigate climate change at a scale larger than any other ocean protection initiative. However, despite humanity's absolute dependence on a healthy ocean and the proven benefits of MPAs, only 7% of the ocean is currently protected. So, how much of the ocean do we need to protect? The science is clear. We need to protect at least 30% of the ocean by 2030 to prevent the collapse of our ocean life support system. Over the past 12 years, our Pristine Seas team has used a combination of expeditions, research, media, and policy work alongside local communities and governments to create 23 of the largest MPAs in the world, covering a total area over half the size of the United States. But we need to do much more. In the next decade, Pristine Seas will help to establish 40 new MPAs and spearhead a worldwide network of partners to reach the goal of 30% of ocean protection by 2030. We will build a new education program, raise global awareness about the benefits of MPAs, and create a movement of young people leading ocean conservation. We will develop new conservation markets and provide the necessary tools and incentives to ensure that these MPAs work and deliver benefits to humanity. Philanthropic funding at all levels is key. For example, $1 million support an expedition to a new location, including research and a film. $5 million help protect 3 new places, and $10 million develop a new ocean carbon market to help mitigate climate change. Restoring the health of our ocean will require a combination of approaches, including MPAs, reducing carbon emissions, and sustainable management of fishing. These solutions, though, are not at odds with one another, but rather provide complementary benefits. But MPAs are essential to this overall strategy. They are the most cost-effective mechanism to restore ocean life and all the benefits it provides to humanity. This decade is our last best chance to prevent the collapse of our planetary life support system. No child has a future without a healthy ocean. The moment to act is now.
I am excited to welcome our finalist, Enrique Sala, Explorer in Residence and Executive Director of National Geographic Pristine Seas, Senior Advisor Kaylee Kreider, and Executive Vice President and Chief Education Officer at the National Geographic Society, Vicki Phillips. They have been important in leading this work. Today's questions have been compiled by MacArthur after accepting submissions from everyone participating today. So let me begin. You mentioned that a 10 million gift would support an ocean carbon market. What is an ocean carbon market?
Well, thank you, Cecilia, and thank you everyone for attending the event today. Let me start with an example. The seafloor, which is 70% of the planet. It is also the largest carbon store on Earth. It contains twice more carbon than all the soils of the land. But we are plowing the seafloor with huge and heavy nets that disturb the sediment and the carbon in it. And much of this carbon is resuspended in the water, and part of it turns into carbon dioxide, which, as we know, is a greenhouse gas that can stay in the air for 1,000 years. So we have a huge opportunity here. Now, our new research shows that the CO2 emissions from bottom trawling every year equal the emissions of aviation globally. So the opportunity is that we can protect the seafloor from bottom trawling and reduce CO2 emissions massively. And we can value that carbon that will not be emitted year after year in a carbon market. Countries can sell carbon offsets, and that capital can be used to finance ocean protection.
Thank you. How do you enforce the protection of marine protected areas?
In our experience, the best marine protected areas are those that are proposed and endorsed by local communities, because when these communities benefit from these areas, they ensure that they are well enforced. But when it comes to larger areas and more remote areas, technology is key. This is why we partner with Global Fishing Watch and Vulcan, which use satellite technology and artificial intelligence to detect illegal fishing in these areas.
What is the role of youth in ocean conservation?
Well, in Nat Geo, we believe that young people and the educators who reach them are key to solving some of the planet's most pressing problems. And research conducted by the Ocean Project found that engaging youth ages 13 to 25 achieves the greatest conservation impact. They tend to be the most interested and willing to act on ocean conservation, and they have a high ability to influence others. With 42% of the world's population under the age of 25, young people are tremendous allies for ocean conservation right now. But in the future, our long-term ocean health and the management of these marine protected areas will be entirely in their hands. And young people have the capacity to create large networks and mobilize them. They are advocating for change in their community, creating new solutions, and becoming ocean stewards now. We see this in sites like our pristine sea sites in Palau, and we see it among our young explorers, such as Bailey Ritter, who developed Rise Up to empower young people through peer-to-peer training and networking, or visual storyteller Nathaniel Soon, who created Our Seas, Our Legacy, a platform for community engagement and to elevate voices in support of marine protection. You know, as one of our young explorers puts it, young people are the Earth's most untapped resource for hope, and they are key to achieving and sustaining the impacts that we seek.
Thank you. Thank you, Pristine Seas, and best of luck. We will turn now to the World Mosquito Project. Mosquito-borne illness ravages communities and takes lives every day. The World Mosquito Project is focused on fighting these diseases: dengue, Zika, chikungunya. Their ingenious idea is to breed, distribute, and disseminate populations of mosquitoes that have been infected with a bacteria that prevents transmission of disease. To introduce their work, I would like to present the Senior Vice President of Science at the Foundation for the National Institute of Health, Stephanie James. Welcome, Stephanie.
Thank you, and thanks for this opportunity. For the past year, all of us have endured a pandemic caused by a respiratory virus. Today, I'm asking you to think back to some other recent epidemics: Zika, chikungunya, dengue, that devastate the health and economies of large portions of the global population. These diseases are all caused by viruses transmitted by Aedes mosquitoes. There are no satisfactory vaccines for any of these mosquito-borne infections, and methods to eliminate the mosquitoes themselves remain totally inadequate. But what if I told you there's a transformational new technology that promises to dramatically decrease the threat of mosquito-borne viruses, and to do so in a highly equitable, sustainable, and affordable way? This is the technology that World Mosquito Program brings to your attention today. They found a way to spread a common bacterium called WOLBACHIA through an entire Aedes mosquito population, blocking the ability of this mosquito to transmit these and other viruses. A recent clinical trial in Indonesia showed that this method dramatically reduced the number of dengue cases and dengue-related hospitalizations. Similar promising results for dengue and chikungunya are being observed in Brazil. Equally impressive is the fact that Wolbachia levels in mosquito populations remain high and continue to block virus transmission for more than 10 years without any need for reapplication. World Mosquito Program has successfully deployed this technology at citywide scale and already has protected over 6 million people across 11 countries. Today, they come to you for help to take the next step, to scale up countrywide implementation in 2 high-risk countries. I've followed this program from its inception and can vouch for the vision of its leadership, the dedication of its international team, and importantly, the respectful way it partners with countries to co-design and co-develop plans appropriate to local conditions. World Mosquito Program is a good bet for success. This mosquito-delivered technology offers a highly effective and accessible new approach to reduce the world's susceptibility to epidemic mosquito-borne infections, and I urge you to give them your full consideration.
"40% of the global human population is at risk of acquiring a virus transmitted by the Aedes aegypti mosquito this year." 40% of the human population, it's a huge number. The viruses that are being transmitted by this mosquito go by different names: dengue, Zika, chikungunya, yellow fever, all diseases that can have devastating consequences for people and communities that they infect. They can kill people to start with, the most obvious outcome, but they can also have more subtle outcomes that are similarly devastating. For example, the recent Zika outbreaks in South America saw the birth of babies terribly deformed by the presence of these viruses. Unfortunately, these babies being born into families and countries where there was really no social safety net to help them. We also see that generally these diseases put a large social and economic brake on communities and countries, preventing economic development from occurring. And finally, we see that when we have major outbreaks of these diseases, that they clog the health system. Hospitals get overrun with people seeking medical treatment. By solving this problem, we can make health systems much more resilient than they currently are in some of the poorest countries of the world. The easy solution, you would think, is just kill the mosquitoes. And while that approach has been tested and tried for many decades now, what we know is that it doesn't work. It's very hard in big urban tropical cities to kill all of the mosquitoes. They're living everywhere around us. We have a solution that's almost the opposite of trying to kill mosquitoes. We actually grow mosquitoes in the laboratory and release them into communities. But the mosquitoes we release are different to the ones that exist naturally. The mosquitoes we release contain a naturally occurring insect bacteria. It's called Wolbachia. We release mosquitoes that contain Wolbachia into the population where we're wanting to treat. And then that Wolbachia spreads itself into the mosquito population and maintains itself there. And what we find without having to kill the mosquitoes is that they become harmless to people. We don't see any disease being transmitted. We don't have to keep administering it year after year as you would with spraying an insecticide or vaccinating children. This is a solution that's applied once and then it creates ongoing protection against the transmission of these viruses. And the result of that is that in many built-up urban areas around the world, this solution is cost-saving for the countries and governments where it's been implemented. We know our solution works. Our challenge now is to really scale it up and get it to the people that need it throughout the world. $1 to $5 million can help us do that by expanding the approach we're taking in Brazil and Indonesia. We can go to new cities and to be able to make an even bigger and bolder impact with what we're doing to show neighbouring countries what can be done with this intervention. With donations up to $10 million, we're able to expand what we're doing into other countries. There are over 100 countries around the world where these diseases are creating havoc at the moment. And with the addition of this funding, we're able to then allow those countries to get access to this technology to help improve the health of their populations. As a scientist, I feel like we're at a very unusual point in time. We've been working on something here for many, many years, and we've gotten to a point where we now have something that could potentially have a huge impact globally. I'm hoping that people will be willing to work with us and come along on the journey that we believe is in front of us to get rid of these diseases once and for all.
I am now going to welcome Director Professor Scott O'Neill from the World Mosquito Project. Thank you to all of you who submitted questions in advance. We're going to get right to them. How would eradicating mosquito-borne diseases mitigate poverty and spur economic development?
Hi, Cecilia. These diseases are devastating when they occur. We see outbreaks which are massive, very large numbers of community members becoming sick at the same time. Whole households typically will get sick at the same time. One mosquito will infect 6 people in the house, if you like. And so what we see is that these diseases bring down the ability of people to work and to earn income. And the convalescence is quite long on them. And so we see people needing to be cared for extended periods of time. And so it drains the workforce, if you like. And that by itself creates quite a break on the ability of people to pull themselves out of poverty if they're not able to work and generate income on a reliable basis.
What challenges to implementation do you face?
Oh, I think we face many challenges. And we face many challenges because the technology is novel. What we're doing is very new and disruptive in a way. And I think the biggest challenge that I think about the most is, and that I'm focused on the most, is really about uptake. Even though we know we've got something that's really working well, it's novel, it's new. And so that requires people to shift from what they're used to doing to something new, and to get on board with a whole new approach, which means leaving behind what hasn't worked for the last 50 years and trying something new. And so that uptake of the innovation is a challenge. And really that's what we're wanting to address in our proposal to the MacArthur Foundation.
So part of that has to do with local implementation partners. How do you identify and train those partners where you work?
Yeah, so, we do all of our work through partnership. It's not possible for us to scale to the size we want to do by ourselves. And so we're looking for partners to work with that can implement on the ground. And we have a set of criteria that are fairly standard. We need groups that have shown that they can run big programs, that they have the processes to be able to manage money and to account for it, et cetera, et cetera. There's a whole set of administrative criteria that we look for around what makes a good partner. But I think there's something in particular that I'm interested in and the World Mosquito Program as a group are interested in. And that is that we don't come into communities as outsiders and want to implement a program. We want to have a local face and work with implementers that are known and trusted in the community. I think the key to scaling up with what we do is really building trust with communities. And so we want to partner with groups that already have that trust with the communities that they're working in so that we can scale most rapidly.
So I'm going to ask you to do this quickly. What impact have you seen in the countries where you have implemented this?
Well, very simply, in Australia, where we first did this work nearly 10 years ago, there's no disease anymore. It stopped. But I think, I just convey a moment, if I have time, of an experience I had in Indonesia a while ago. I was in a community meeting in a place that we'd been working for a couple of years, and I was with some people from the Gates Foundation, Steve Kern, who's at this meeting, and I was sitting on the floor in a community meeting with boiled bananas and peanuts and so forth, talking to the community members about how they feel about the program. And we the question was asked through a translator, what was the impact people were seeing? And two things came back which really struck me. And that was that one woman got up and said that people from neighbouring areas were bringing their children into this area now to put them into childcare because they could recognise there was no dengue here anymore and they wanted their children to be there. And then the second person came up and said that real estate values had increased in that area as well because it was considered dengue safe. And so I think it's one thing to have scientists with, statisticians and epidemiologists telling you exactly what the reduction in disease is, but when it's so profound that the community senses it itself and acts that way, you really know you're having big impact. And that was a moment that's really stayed with me for a long time. Yeah.
That's impressive. Thank you again, World Mosquito Project. We're going to turn next to the Clinton Health Access Initiative and Murdoch Children's Research Institute. Hypoxemia, or low blood oxygen, increases the risk of death 7-fold, regardless of the initial cause. The Clinton Health Access Initiative and Murdoch Children's Research Institute project is focused on oxygen therapy, particularly in healthcare institutions in India and several countries in Africa. To introduce their work, I would like to present Steve Adudans, Medical Oxygen Ecosystems Expert. Welcome, Steve.
Thank you. Thank you, Cecilia. The World Health Organization has recognized medical oxygen as an essential drug needed to avert mortality due to chest infections, especially pneumonia, amongst children under the age of 5 years. Furthermore, oxygen has been recognized as a critical treatment for COVID-19. The unprecedented pressures on the medical oxygen ecosystem have exposed multiple gaps in health systems globally. Developing countries struggle with, one, inconsistent availability and limited local oxygen production, which is prohibitively expensive where available, and two, inadequate access to oxygen-related equipment such as pulse oximeters, which are used to detect low blood oxygen levels. 3, insufficient numbers of frontline health workers with adequate training. And finally, 4, inadequate transportation systems for oxygen to reach where it is most needed. No one, no matter where they live, should die for lack of oxygen, a condition we can diagnose easily, treat affordably, and prevent globally. The Clinton Health Access Initiative and the Murdoch Children's Research Institute are working to make pulse oximeters and medical-grade oxygen available to hospitals for patients, but they do not stop there. They're also putting in place screening procedures for low blood oxygen levels, maintaining oxygen systems, and managing transport for patients who need to be treated in a larger hospital setting. Their pilot projects have already saved lives. After working with 74 Nigerian and Ethiopian hospitals, the proportion of children with low blood oxygen levels receiving oxygen doubled, and the risk of death dropped dramatically. To addressing the gaps in the oxygen ecosystem requires both a critical analysis and strengthening of the entire health system. We need to ensure that effective information and diagnostics are available at the community and frontline levels, and that safe, appropriate, and effective treatment is provided at all stages of healthcare. The team you're about to hear from does all of this work consistently and innovates as conditions change and the new challenges arise. When the COVID-19 more than doubled the volume of oxygen needed to meet clinical demand. This team quickly pivoted to address the additional demand, working to leverage emergency response efforts to create a stronger foundation for sustainable long-term improvements. As someone who has had first-hand experience in setting up oxygen ecosystems, there is no one-shoe-fits-all solution. Efforts that have been galvanized so far during this COVID-19 pandemic are definitely a step ahead in our journey of 1,000 miles towards a hopeful future. It therefore gives me great honor and indeed pleasure to introduce the Clinton Health Access Initiative and the Murdoch Children's Research Institute. These are global organizations with measurable local impact that have recognized the need to develop an effective medical oxygen ecosystem and engage multiple partners across sectors that together will catalyze more investment for resilient and sustainable response now and in the future.
Low blood oxygen, or hypoxemia, is a common but deadly complication of many illnesses. It is easily diagnosed using a pulse oximeter, and medical oxygen is the only treatment. Oxygen is readily available in wealthy countries, but is often unavailable in lower-income countries where clinics and hospitals lack the infrastructure, tools, and skills needed to deliver oxygen to patients.
Oxygen is one of the most essential medicines for saving patients with COVID-19 and many other conditions. Many countries simply do not have enough oxygen available to assist sick patients as they struggle to breathe.
More than 46 million patients require oxygen every year, from newborns struggling to breathe in neonatal units to adults fighting COVID-19 in ICUs, or patients undergoing even simple surgeries. The need for medical oxygen also reaches beyond hospitals, in ambulances, rural health centers, and all across the healthcare system. But health facilities often don't have the equipment they need to diagnose and treat patients. Even when they do, health workers often aren't trained on best practices, and technicians can't fix broken equipment. As a result, only 20% of hypoxemic patients are diagnosed, and less than half receive oxygen.
Most of our children, the first point of care is at a dispensary level, and at the dispensary level, there is no oxygen. If there is any referral, the mother has to wait until an ambulance is sent from the central point, which is about 30 kilometers to the facility, to be able to save that child. And that child would be there without oxygen until the time the ambulance arrives.
The worst pandemic in a century has widened the oxygen gap and pushed many health systems beyond their limits. But we must take immediate action and make access to oxygen truly equitable, now and into the future. We know how to solve this problem. Our approach was built while working to increase access to oxygen for childhood pneumonia through pilot programs in India, Ethiopia, Kenya, Nigeria, and Uganda. We do 4 things to make sure we get oxygen to patients who need it. We help governments and their suppliers build partnerships that provide reliable, affordable oxygen to health facilities. We support doctors and nurses with clear clinical guidelines and training so they can quickly and confidently diagnose and treat hypoxemia. This includes the use of handheld pulse oximeters and training for technicians so they can keep equipment running. We support governments to develop financing mechanisms to fund operating costs, increase capital investment, and keep oxygen systems running without donor support. And we build data systems to measure progress and target investments to where they are needed most. Together, these four components can close the oxygen access gap and build a system that will sustain itself and last far beyond our support. But we need partners like you to put this plan into action. $1 million will train health workers on hypoxemia management in over 300 health facilities in one country. $5 million will establish partnerships with industrial gas suppliers to reduce the cost of oxygen by up to 70% in one country. $10 million will see oxygen plants installed in all referral hospitals for one country. Together, this coalition can help us reach our first milestone of $50 million to get our program off the ground in India, Ethiopia, Kenya, Nigeria, and Uganda. Now is the time to invest in a comprehensive approach that helps countries address today's crisis, prepare for tomorrow's, and build long-lasting systems to save lives for generations to come. Together, we can close the oxygen access gap for good.
I would now like to welcome Director of Essential Medicines, Audrey Batu, Senior Technical Advisor, Jason Howdeck, and Senior Research Fellow, Dr. Hamish Graham, to discuss their work. Again, these questions have been compiled by MacArthur after accepting submissions from everyone participating today. How does your work, which is centered around oxygen access, strengthen health systems overall?
Thanks, Cecilia. I think Dr. Tedros said it really well. Oxygen is one of the most essential medicines. And as a doctor, I need oxygen for a whole range of patients every day, patients with pneumonia, patients with COVID, but also preterm babies, mothers in labour, trauma victims, every patient who needs any surgery. Improving oxygen systems doesn't just benefit one group of patients, it benefits every sick patient who needs care. And in wealthy countries, oxygen is something we've taken for granted for a long time. I think probably before COVID, most wouldn't have even contemplated providing care without oxygen being readily available.
Right, and I think COVID has really highlighted the fact that in hundreds of thousands of hospitals across the world, you have health workers who face that reality every day of showing up without oxygen. So by building the systems and the partnerships that get oxygen to patients, we're actually able to not just provide care to one group, but provide care across the health system.
Thank you. Your model is built on public-private partnerships for oxygen supply. Can you expand on these partnerships and explain why they are vital for ensuring the sustainability of your work?
Thank you for that question. It's a great question. This is really core to who CHAI is and why we were founded. We were founded on the belief that all patients should have access to affordable care. And when we started out, it was about ensuring access to HIV treatment across the world through partnerships in the private and the public sector. And we were able to bring that treatment to millions. We followed that with treatment for malaria, treatment for pediatric HIV, and now this is really the time for oxygen.
And I think with oxygen, that's been the piece that's really been missing, because we have seen a lot of efforts, for example, equipment donations to try and alleviate the problem with oxygen access. But without actually changing the underlying system and the structures, we won't see that equipment get to where it needs or benefit the people. So that's what I'm really excited about, hopefully so that we can make oxygen something that we can all healthcare workers can take for granted.
So one of the other questions is about partnerships and why this partnership between CHAI and Murdoch?
Yeah, that's a great question. I think when we decided to go for 100&Change, there was no better partner than we could think of than MCRI that we would want to do this with. And that's because I think what they bring in terms of their research and clinical expertise is amazing, and a huge strength, I think, to us at CHAI. So we bring experience, bring interventions to scale, but they're the other half of the puzzle, and they really complete this team for us. Hey, Michelle, let you comment.
Yeah, and I think that was really similar feeling from our side. We had the clinical experience with hospitals. We'd found some things that really work, things that got oxygen to twice as many patients that were getting it before, reduced the child pneumonia deaths in hospitals by 50%, cut them in half. But what we were looking for was how to take it to scale. And for me, I feel like this is a good example of two organisations tackling a complex problem and bringing our own strengths, as well as partnerships in many other places, to be able to make the solution actually much more feasible and simple and possible.
Thank you. Thank you, Clinton Health Access Initiative and Murdoch Children's Research Institute. Best of luck to you and to all of the finalists participating. This has truly been an enlightening experience. I am now going to turn us back over to MacArthur Foundation President John Palfrey for final remarks and to let us know about post-program plans.
Cecilia, thank you. Fantastic job today. And you brought that sense of hope that you had from reading all those great applications every morning and shared it with all of us. Thank you. Everyone, please let's imagine we are in an auditorium together and join me in a big round of applause for that program. Thank you, finalists. Thank you, experts. Thank you, Cecilia and your team. Really wonderful job. One of the 6 finalists will receive a grant from MacArthur for $100 million to scale their project, to make real and measurable progress in the lives of the communities they highlighted today. Never has their work been more important or your investment more necessary. We are living through multiple global crises, a public health pandemic, economic collapse, and a racial reckoning that calls on us to dismantle the structures and practices that uphold systemic racism. Climate change touches every aspect of our way of life. It is harder for the average person to separate truth from fiction in their news feeds, and the bonds of social trust are frayed. It is in this moment that we most need hope. And that is what we got to experience today. These solutions are possible. With their ideas and your action, we can all dare to hope. This community is connected by common values, the belief that we can get together and do some good. Seize this opportunity to be as involved as possible in this work. Make today the beginning of your engagement with these projects and not the end.